this. It's a little bit of an experiment in that what I'll try to do is speak for maybe 20 minutes or so and then start taking questions. If there are no questions, I'll speak for the rest of the time. If there are, I presume that you will handle the questions. Is that right? Since you're in charge of the you're in charge of the technology, so you'll let me know when there are questions. Is that
Yes.
fair?
Yes.
At any point that you have a question that you want me to answer, just let me know, and I'm going to sort of put out my message and then stop, and we'll take. I'll ask for questions, and as I say, if I don't get questions, then I can go back and continue presenting some of the information I want to present. So
yes,
the title that I chose and what we're using, just so we're focused, is Medicine, Law, and Healing, Health, Freedom, and Order in a Volatile World. I began working on these ideas in 1968 when I came to Washington, D.C., and I've been here in Washington, D.C. That behind you is actually the San Francisco Bay Bridge, but I am actually in Washington, D.C., and I've been here since 1968 working on issues of regulation by the Food and Drug Administration in the United States. And the Food and Drug Administration in the United States is the primary regulator on a federal level of the health products that are sold in this country. They are a regulatory agency. Their activities affect approximately 35% of the gross domestic product here. And their rules that they establish here in the United States tend to be adopted around the world. One of the more interesting things that I learned in my experience is in the mid-1968s, 1966 to 69 roughly, 66 to 67, 68, in those periods, I took several trips to India working on consumer affairs matters concerning food and drugs. And one of the things I discovered, which I found to be very, very instructive, is that the food and drug law in the United States, which was adopted here in 1938, was adopted in India almost word for word, the exact same law. So it was quite interesting to be spending time in both countries and seeing how they regulated their products. There's much more opening for homeopathy in India than there is here at the moment, although the law here is very open to homeopathy in principle. In practice, the FDA has taken the position since 2017 that it wants to take actions that will decrease access to homeopathy. Americans for Homeopathy Choice is a consumer group that's opposing that. And there are basically there are about 20 groups of people supporting homeopathy in the United States that support the Americans for Homeopathy Choice. But the 1938 Act actually, for the first time, specifically identified homeopathy as a part of American medicine. That was in 1938. Between then and 2017, the Food and Drug Administration carefully excluded homeopathy from all of their various regulatory initiatives. They specifically identified it as a unique and distinct form of medicine that was outside the framework of the FDA drug regulation system, even though they were defined as a drug in the legislation. So just a simple way of putting that again, a drug in the United States, it consists of, by definition, anything that's homeopathic, a homeopathic remedy, or an allopathic chemical that has been shown to have benefits that outweigh their risks in healing diseases. So that's homeopathy, allopathy. Together, that's the definition of a drug in this country. And from 1938 until 2017, homeopathy was given basically able to, as long as it was manufactured properly and labeled properly, it was a free pass to use it. Most people didn't know that it existed. The people that did were very happy with it. It's now estimated that it's a $3 billion market in the United States, and that there are about 3 million people using it. And that's the estimates of the FDA. We believe that it probably is a good deal higher than that, because there are a lot of folks who use homeopathy without using a homeopath. And so many naturopaths, thousands of naturopaths, in fact, use homeopathic remedies as part of their larger practice. So homeopathy does have a good foothold in the United States. It is arguing effectively legally. The legal arguments are taking place on three fronts. There is a case in court right now in which the FDA is being asked by the judge to please, the FDA is being ordered by the judge to please put forth why they want to restrict homeopathy more than they have in the past. That's, a judge has asked the FDA to do that on the basis of the FDA's taking actions that homeopathic community sees as restrictive. In the FDA itself, Americans for Homeopathy Choice has a petition pending. That's a movement to get a new regulation for homeopathy that would put in place in law what the FDA has allowed in practice over the last, since 1938, basically. They've allowed homeopathy to exist as a unique, separate form that did not have to be subjected to new drug research, and did not have to apply to the FDA for a new drug application and approval. That's the way homeopathy's been until 2017. The FDA said they were going to change that. Americans for Homeopathy Choice has a petition in court, in the FDA, objecting to that and saying, no, keep doing it the way you've been doing it the last 70 years, or I guess about, yeah, it's probably about 70 years, 80 years. In any case, that's in the FDA. With regard to Congress, which is where the laws are made here, in Congress, we have legislation taking shape that will say that homeopathy is not a new drug, that it should be treated as old drugs are treated. And there are many old drugs on the market in the United States, such as digitalis and drugs of that kind, several hundred, that the FDA does not require to have a new drug application. And we're saying homeopathy deserves to be in that class, has been in that class all the way up until 2017. And we now want Congress to reinforce that. And it's interestingly enough, there was a Drug Reform Act passed in 1979 in the United States Senate, which is one part of the American Congress. There's the Senate and the House of Representatives. The Senate passed a law which in fact did exclude homeopathy from drug regulation as a allopathic drug. And that law passed the Senate, but it died in the House. And what we're saying now is it's now come time to repass that law in the Senate, and this time pass it in the House. So we have then going on the congressional activity to restate the law that was stated in 1938, passed the Senate in 1979, again, a restatement, and now we're asking them to do it again. That's in the Congress. In the courts, we have a case in which the FDA blocked some homeopathic remedies from entering the country, arguing that they had not passed the new drug test. And the court is asking the FDA to submit a justification for that, saying why they would change their rules from 1988 to now. Why would they change their rules? That's in the courts. And then at the FDA, we have a petition pending, which is supported by over 20 homeopathic groups, that the FDA should treat homeopathic remedies the same way that they have treated them in the last, since 1938. So let me just figure that out, 62, 82, 83 years, got it. So anyway, the effort to move homeopathy forward in that manner legally is well underway, and more people are turning to homeopathy. So let's step back a little bit and look at homeopathy in the United States, and I think worldwide a little bit larger, a little bit higher up. the title here is Medicine, Law, and Healing. And what we are approaching it from, the standpoint we approach it from is the standpoint of the ultimate patient, the ultimate end user, the consumer. What are the tools available for a consumer or a patient or a client to use to ensure their best health? And one of those that we believe exists there is the right to choice, the right to informed choice. If you have the right information and you know how to make the right choices, you will then be better off in advancing your health than if you are deprived information or blocked from making choices. And so our argument on behalf of homeopathy in all those legal forums that we described is to preserve the right to choose homeopathy. That's how medicine and law fit together in our society to create healing. On the homeopathic front, the way homeopathy works is it starts with the individual. That's what we would say. The individual is the end user. The homeopathic practitioner works with the end user, and they work personally, individually. They create the unique profile for that individual, and then they work with the homeopathic pharmacopoeia and the various documents that support the homeopathic pharmacopoeia, and work on the remedies that are available. And the whole purpose of a homeopathic practitioner or anybody choosing homeopathy is to fit the remedy with the profile of the patient. Now, I have to say to you that it was mentioned in the introduction that I wrote a book in 1970. It was published, called The Chemical Feast, the Nader Report on the Food and Drug Administration. And while I was writing that report, I was contacted by a gentleman here in the United States, Dr. Harry Coulter. He was a political scientist and historian, did a lot of writing, and was a very, very strong advocate of homeopathy. And the book that he was then in the process of publishing is a book you should all take a look at, which is called Divided Legacy. And it's the history of medicine in the United States, focusing on homeopathy. In 1900 in the United States, the President of the United States proclaimed Hahnemann to be the father of modern medicine, and installed a statue in Washington, D.C., which is the premier thing you can do for a person in the United States. Give them a statue in Washington. And Dr. Hahnemann is the only MD who has a statue in Washington, D.C. Now, this is an important marker. At that point, Harry Coulter estimated that maybe as many as a third to a half of all the doctors in the United States were using homeopathy. The following 30 or 40 years saw pharmaceuticals become more and more dominant, growing out of the oil industry, then the chemical industry, then the pharmaceutical industry, and they became an argument. There was a huge argument for using them, and that argument was the opposite of starting with the individual. That argument starts with population groups and says, what chemicals can we give to this population group that will cause them to, as a group, be healthier? So they use that particular argument is used to address things like most of the infectious diseases began with that, and then chronic diseases, so cancer, heart disease, stroke. They all have drugs. A drug is an allopathic drug that they use for them. And the drug becomes something in the United States by virtue of a inherently unsafe chemical being shown through a new drug application to have more benefits than risks. And then it's used for the treatment of those diseases that I described: cancer, heart disease, stroke, diabetes, and so forth. That is the idea is that in any group of people, if most of them take these drugs, the disease in that group will diminish. The homeopathy argument is that any individual who has a particular pattern of symptoms or expressions, if they take that, if they can find the right remedy and take that, that remedy will cause them to improve their health. And then collectively, if everybody did it, the argument would be that the health of everybody would get better. Well, when I read the materials that Harry Coulter was pulling together, I went, as I do in all instances when I find something new, I went and found a homeopath in Washington and spent some time with him and got analyzed by him in terms of what the profile was for what was called, otitis externa, which is an external earache that I would get from swimming, and also for hay fever, which I had a mild hay fever. And it was very amazing. Taking a remedy, they both went away. So I thought, well, this is a very interesting approach. And then from then on, that particular doctor has been my primary healthcare professional, although I have also a mainstream doctor who is very, very open to homeopathy, doesn't use it, but he's open to it. He understands how it fits, and he does all of our analysis of physical and so forth. And I put that in there merely to point out that when I take medicine and law and put them together, I can come up with healing. And it's for myself. We have everybody that we can talk to. We tell about homeopathy and why they should at least be aware of it. And when we were beginning our work with the Americans for Homeopathy Choice, we all went to the FDA. When I say all, there were 8 people. There were 8 mothers. These were mothers who were treating their children with homeopathy. All went to the FDA and brought with them their kits of 100 remedies. And we brought 8 people because there were going to be 8 FDA officials there. And we sat down with the 8 FDA officials, and we had, at a certain point in the conversation, we asked them if they had ever seen a homeopathic remedy. And mostly they said no. And so we said, well, here they are. And the mothers took out their kits and handed them to their counterpart across the table and said, here, take a look at it. Go ahead, take them out. Don't worry. If you mix them up, it's no problem. We can put it back together. And yes, we do know what each of the 100 is used for with our children. This was a huge eye-opening experience to the people who were at the FDA. And we talked through that, and then that led to series more conversations. And we have had a very respectful and positive response from the FDA, including with a series of several doctors, a set of several doctors who went and met with them, homeopathic doctors. Interestingly enough, as we were leaving that meeting, one of the public health service officers working with the FDA came forward and said, and she looked as if she said she was from India, and that her uncle and father were both homeopaths in India. And she herself was very positive about homeopathy, and she wished us well in moving forward and getting the regulations changed. So I just wanted to mention, when I say changed, they were trying to move the regulations against homeopathy, and we were saying, no, keep them the way they are, and in fact, move them more for homeopathy. So that all took place. Now, the point I wanted to make in relation to the title is that it's the interaction between the way the law works, the way medicine, in this case, homeopathic medicine works, although it also affects allopathic medicine, and that those mechanisms are all integrated effectively if healing is to occur. And we are getting healing. So I'm talking about the notion of having an orderly system. That's what the law presents. And then we're having freedom, the right to choose. Integrating order and freedom effectively will give you the tools to manage in what I called in the title, a volatile world. And one of the most important parts of our current situation, and this will be the last point, and then I'll stop for questions. And believe me, if there are no questions, I can continue on. But when I was working with the Nader organization in 1970, I was approached by the former Secretary of Health and Human Services. That's the senior health official in the United States, former senior health official in the United States, who said, when I was secretary, it had been 3 years earlier, when I was secretary, something was going on in vaccine regulation that I was unaware of, and I'm worried that it's not being done well. would you look into it? So we did, and we spent basically from 1970 to 1980 changing the way vaccines are regulated in the United States. And the change was that at the time, vaccines were regulated by the National Institutes of Health, and the primary purpose of the regulation was to promote the manufacture and sale of vaccines, and they were not being subjected to the right kinds of testing, in our opinion. So we laid that all out legally, just the way we're doing now, and on homeopathy itself. And the result of that activity actually peaked in what we had here in the United States in 1976, which was called the swine flu epidemic. So swine flu came to the United States in 1976, and the federal government decided to vaccinate 200 million people. We were in the field pointing out how the law works, how the science works, how integrating them creates a better outcome. And we raised serious questions about the safety and efficacy of the swine flu vaccine. The government went ahead and announced that it was going to inoculate 200 million people, but at 49 million, they stopped because so many people were being harmed by the vaccine that they felt that the trade-off was not a good trade-off. And so it was stopped. And then we went on from there and it developed materials at that point. AIDS emerged, and the basic premise on AIDS was it was a viral disease, and then efforts were made to do an AIDS vaccine all the way from 1981 until now. They're still trying and haven't been successful. But a lot of the information and so forth that was drawn out of creating the effort to create the AIDS vaccine has gone into creating what are basically now, there are 32 vaccines being researched in the United States for COVID-19. A lot of the research that's leading to that effort has come out of the effort to find an AIDS vaccine. In the meantime, we're making the argument that while whatever goes on the vaccine side, it's very important for the public to have a wide range of choices. And one of those choices needs to be homeopathy. And that's what we're arguing for. And we're saying individuals fully informed and knowledgeable about their own health will make better decisions about how to take the vaccine, which of the 32 vaccines to take, when they should take them, or whether they should take homeopathy or something else. There are many other people approaching things. And there's also the question of treatment versus, prevention. There are ways of treating COVID-19, for example, or any other disease that are not necessarily the same as the ways of preventing it. So all of that is involved in what we call the volatile world that we're in. And by the way, this kind of thinking goes on in all kinds of areas. We have a big thing going on about whether the planes that are being flown today by one of the airlines are actually safe enough to fly on. And the same kinds of discussions are going, how much regulation, how much freedom, how do we integrate freedom and order to come up with how do we make safest airplanes, same as how we make the safest approach to healing, the same as how we make the safest food, and so on. Now, I mention all of this because I believe that we are in a big evolutionary shift in which material answers, the idea that we can come up with a technology or a designed box or building or structure or government agency, that we can design something that is a mass type activity or effort to solve our problems. We're shifting from that as our primary idea over to there's a lot of energetic dynamics underway. And at the heart of homeopathy is a huge energetic rollout or shift or expression. People's personal energy and the healing energy of homeopathy combine, and you come out with a better result if you can match them well. There's a huge amount of data underlying all of this that needs to be thought about, and we can, if you want to, go into questions there. My main point here is that moving forward in this way requires a sensitivity about the law that makes it possible for these choices to be preserved. You cannot expect to succeed in any one of the vast number of choices that exist for every individual without being very, very careful in using the law effectively and getting the issues that we're talking about addressed by the law in order to create the space for the choices that we're saying people should have the right to make. So that's the basic premise of medicine, law, and healing that I'm putting forth in health, freedom, and order in a volatile world. Health, freedom to choose in an orderly legal system in a way that will help us navigate a total global, if not universal, shift in how we are relating to the power and energy that drives life. That's my comment, and I'm very happy to take questions. I think I saw a couple in the chat there.